Okay, good morning. Today we're going to learn about the second video for the labeling. And first of all, we'll see this picture from the Splanchnology chapter. And two kind of organ we are having in the Splanchnology. So this is one of the organ, what we call that parenchymatous and the tubular. So tubular organ is in front of us. We need to know that how to label this kind of organ in the examination when it come in front of us. First of all, we can see that the most outer layering here, that we call that serosa, this layer. And right after the serosa that we can, if it is double layer, that we can also say that the mesentery. And in the mesentery we can see here the blood vessels and the nerves are passing through here. Next, the second layer, that from external to internal, that we got here, that is a muscular layer. In this muscular layer that we can see that two kind of muscles here, the circular and the longitudinal. And in between the circle and longitudinal that we are having here, the nerve plexus, we call that myenteric plexus, as we can see here, myenteric plexus. Right after that, we are having the third layer, that we call that the submucosal layer. And between the muscular and submucosal layer, that we are also having another kind of plexus here, that we call that submucosal plexus. These two plexes together, myenteric and submucosal plexus, known as the enteric plexus. Now we are going to the most inner layer, that what we call that the mucosal layer. In the mucosal layer, that we can see here the green colored dots representing as the lymphatic nodules. And here we are having the epithelium, and we can also see some muscular layers over there, and some glands in the mucosa and in the submucosa. So this picture you need to remember in the well-pay, that now these are few important points that what we can see from the Splanchnology chapter. Let's go to the next portion, that here. This is the oral cavity, that in the oral cavity you need to remember about the teeth's name. You need to remember about the frenulum, upper and the lower labium. We need to remember about the tongue parts, that anterior and the posterior portion. We need to see here the palate, hard in the subpalate, uvula, two kind of arches here, plateoglossal and the platopharyngeal arches. And in between that we can also see the palatine tonsils, and backside here there's the opening that we call that oropharyngeal isthmus. So pay attention on this picture too. Next we got here the picture for the teeth. In this we need to know that outside here we are having the clinical crown, also known as the anatomical crown. And then we got here the neck, and then we got here the root, the lower portion, and here we go to the apical foramen. The teeth are joined with the bone, either it is upper or the lower jaw. That the bone we give the name as the alveolar bone, that due to its shape. We got here the ligaments, those are holding it here, as example of gymphosis, that we call that periodontal ligaments. We got here the cement. We got here the root canal. We are having here the pulp cavity inside that, where we can see the vessels and the nerves over there. We got here the dentine. We are having here the animal and the elevations on the teeth, that we call them the cusp. And except that we are having the gums here, what we call them gingiva. Surely I'm speaking a little fast, that you can slow the video and then you can watch it or download it and watch it again and again. Next, go to the next picture, that from the digestive. Here we can see that the most important organ in the digestive, that the stomach. Here we are having the esophagus and the duodenum part, and we can see here also that this is tubular organ, that the most outer layer, the adventition. And then we are having the muscular layer. In this muscular layer, that we are having the three kinds of, as the longitudinal and the circular and the oblique muscles. So we got here the parts of the stomach, as this is the cardiac part, this is the fundus, this is the body, and here we go to the pyloric part, which is further divided into two regions. And we got here the greater curvature and the lesser curvature. We also get here the cardiac notch and the pyloric intramural notch, that we can say. And remember that the folds inside the stomach, that we call them the gastric fold or rugae when it is empty. Now we go to the next picture. That's the liver. we're having here the anterior surface and the inferior surface. Let's talk about the anterior surface. First of all, we are having above that is a diaphragm, and downside here this is the left lobe, and here we go the right lobe. In between that we are having here the falciform ligament, and the downside here when it is ending, that is showing a little bit round shape, so we call that a round ligament. And here we can see the gallbladder. Now let's have a look here on the posterior or inferior surface. We can say here this empty space that is showing that is the bare area, and in the bare area we can also see the both side of the ligament, the triangular ligament and the cardiac ligament anterior posteriorly. We got here the inferior vena cava. We are having here some impressions on the liver, also need to remember, and here should be the ligament. We call that transfer hepatic ligament. These structures need to remember. What we got here, we are having the porta. In the porta we are having the hepatic portal vein, hepatic duct and the hepatic artery respectively. Okay, so here we can see the H-shaped portion here. In the H-shaped portion, about the bar here, in the bar we are having here the three structures that respectively we give them the name as the portal vein, hepatic proper artery, and we got here the bile duct. And for this part here we are having the inferior vena cava. Here we got the gallbladder, which is neck, body and its duct, what we call that cystic duct. And we got here the left side posteriorly. In the left side that we are having here the ligamentum teres hepatis, and we are having here the ligamentum venosum. We go to the next picture now. That is belong to the large intestine. So when we talk about the large intestine portion, that we need to remember that it's having its 5 parts, starting from the cecum, colon, and then we got here the rectum and anal canal. We got here the very important part from the large intestine, but we call that appendix here, the finger-like projection as the posterior inferior side. We are having here the ileum. We are having here the ascending and the transfer and descending and the sigmoidal colon. We need to remember some features on it, very important, and those are limited to the colon. That is the tinea coli, this band here, and we are having here the fatty sac small one that we call that mental appendices, and balloon-like structures here we call then the history of the colon. Next we are having the picture that is the anterior, posterior and the sagittal view of the larynx, in which we need to remember about that is the epiglottis. Here we are having the hyoid bone, and we got here the thyroid cartilage, cricoid cartilage, and here we are having the trachea. Let's see that from the posterior view, that we are having the arytenoid cartilage above the cricoid, and we are also having here the corniculate cartilage, and we are having the cuneiform cartilage. Cuneiform mostly present in the membrane. So we got here 2 kind of ligaments. The upper portion that we are having the vestibular ligaments, and the lower we are having here that is the vocal ligaments. Those are true vocal cords. By the vibrating we are having the sound. Let's go to the next portion, that here we are having the right side of the primary bronchi and the secondary and tertiary, and we can see that the trachea, left and the right primary bronchi, and then the secondary and then the tertiary. In the tertiary, first of all, here we are having the apical, and then the anterior and the posterior segmental. Then here we are having the lateral and the medial segment. Here we got in the inferior part that the superior, medial and the lateral, and then after that anterior and the posterior segment. So need to remember about the segments. Either it come like this, or maybe on the directly on the liver, directly on the lungs. Let's look at the external features of the lungs and from the anterior view. That what we got here, the apex, both sides. We are having the upper lobe and the lower lobe. Here we got the upper, middle, and the lower lobe. Here we got the oblique fissure. We got here the horizontal fissure and the oblique fissure. A very important marking here that we are having the caudate notch, and then side we are having here the lingual. We got here inferior border. We got here anterior border, and at this place we are having the posterior border. So remember this external features of the lungs in the marking it make it come. Next we got here the pleura, especially we can say that is a parietal pleura. Here we got the first of all that the suprapleural membrane. We got here the cervical pleura. We are having here mediastinal pleura. We are having the diaphragmatic pleura and the costal pleura. And in the mediastinal part, that here we are having the opening, that what we call that this part that is the pleura surrounding structure in the root of the lung, and downside extension here, that is the ligament of the pleura. And may also remember about its extension and also the recesses about. Next organ in front of us is from the urinary system that we are having here, the kidney section here in front of us. That first of all we can see here, that is the ureter. We are having the renal artery and the vein respectively, and where they are entering into it, that this area we call that the hilum, entry exit point of the parenchymatous organ. So we got here the renal cortex outside and then the renal medulla. They are respectively showing here the renal column and the renal pyramid. And we got here the renal papilla, renal minor calyx, and minor calyx join together make the major calyx join together, and then they make the renal pelvis. So make sure that you are remembering superior pole, inferior pole, external surface, or its outer covering. Next we got here the male reproductive system. That is a sagittal view in which we can see here first of all the scrotum in the side, the scrotum that we got here, the testis, and then we are having the epididymis, and then the ductus deferens, and ductus deferens passing away, that is the urinary bladder. Here we are having the ureter, and the back side here seminal vesicle. We got here the prostate gland and the bulbourethral gland, and inside the prostate here we are having the ejaculatory duct. Backside here is the rectum, and we are having here the anus. And if we come to the anterior side, that here we can see the urinary bladder. We are having the urethra with its three parts. Need to remember, we got here the external genitalia of the penis. Here we are having the glans penis and the skin, that what we call that prepuce. Next picture, that is a female reproductive system, that is the Sagittal View 2. Here what we can see first of all, that externally we can start here the labia majorum, labia minorum, and here we got the clitoris. We are having here the urethral orifice, vaginal orifice, anals, and the rectum. We got here the uterus. We are having the ovary here. We are having the uterine tube here, and except that we are having the cervix of the uterus. We are having the urinary bladder, pubic symphysis. So mostly that this kind of structure you need to remember to label in the picture. Thank you very much. See you in the next video.